so we did have a brief conversation before the interview, as I like to do, and we just talked about, sort of the underlying reasons why autoimmune diseases or the mechanisms of autoimmune diseases that are common would include inflammation, right?
Absolutely.
Or hypoxia,
yes.
which leads to the inflammation. And
Yes.
and so did they teach you about that, when you got your doctorate in pharmacology?
Some. I mean, that was certainly talked about, but I really started to understand the trajectory of an underlying inflammatory process when I got sick. I mean, I applied my medical knowledge to that healing process, but that wasn't a cornerstone of what we learned, and it really became a cornerstone of my own healing, that getting control of inflammation was the way, that my immune system was going to ramp back up, and that my body was going to heal unequivocally. It was all about addressing the inflammation.
Well, I'm curious with the Lyme disease now. One of the things that I learned early on in a medical conference out in Albuquerque with the Hyperbaric, the International Institute at the time, IHMA, were the two. And one of the things I learned early on was, number one, the connection to inflammation.
Yeah.
But it was a 3-day conference, and for me, there was doctors and clinicians there. I'm sure I was the only structural engineer in the group, but I was led to that by this military connection, looking to try and reduce the suicide rate, because it's horrible what's going on in this country.
Absolutely.
And that extends beyond the military itself into other sectors and just drugs and all of those things. And I was there for that reason, but what I was exposed to was so much more.
Yes.
And I would say that I remember I had a yellow legal pad that I completely filled. And I tend to be narcoleptic at engineering, conferences.
Okay.
And I would tell you I was at the edge of my seat for 3 days, and I filled that pad, and I've never read that pad, because then I realized it's all published. Okay.
Right.
So why would I?
Right.
Because I can get right down to the science and really understand how to read the science. And so, but one of the groups that was there, or one of the studies that they talked about, was Lyme disease, and that there is a following of people. I don't know if you could find it like on the social media platforms, where there are Lyme people that have done HBOT and they're just out pushing it because they believe it. And from what I understand, talking with the medical directors that have been here, one in particular, Dr. Stevens, said that the way he viewed Lyme disease was that it's a virus, and that higher pressures with pure oxygen, not to the point where you'd be concerned about oxygen toxicity, because you can get too much oxygen, kind of like you can drown by drinking too much water, right?
Right.
We never go there in this industry.
Right.
Industry doesn't go there, but they're aware of it.
Right.
Okay, because that science has been determined, is that you go to a higher atmosphere so that you're feeding that virus so much oxygen you kind of drowned it.
Right.
That there is a separate protocol that should be developed for Lyme disease. And I think one of the areas that we find, and I think maybe this would sort of resound with your background, is that the industry has tried so hard to survive because it's been attacked. Primarily because I believe you just can't patent oxygen. It's been around.
Agree.
It's been around a long time since the atmosphere was formed.
Right.
And so one of the things about all drugs, as I'm sure, as you mentioned, you're doing the safe and effective studies, is dose.
Yes.
Dose is something you must talk about a lot.
Oh yeah. All the time.
Yeah,
critical.
And that's where the hyperbaric industry has been derailed in all of the controversy and all the sort of the pushback from the medical industrial complex.
Yes.
Is dose should be what we should have been focused on that for the last 100 years.
Yeah.
And so I think when you look at things like Lyme disease, whether whether Dr. Stevens, which was his opinion of what might be the approach, could be tested. We should be testing all of these autoimmune diseases, all diseases,
absolutely,
and really understanding what's the dose. And we interviewed Dr. Harch here. He was here for, I think, 9 segments and conversations. And then we did a live session. is that he's big on dose and trying to determine how you determine what the dose is for the patient.
Right.
Because you don't only have the indication or the disease, right, you're dealing with,
right.
but you have, the physiology of this person, their age,
Right.
their body makeup, their genes. We're all
Right.
unique.
Right.
So I think it's unfortunate that the industry is not more focused on dose. Because you go to a place like Extavita, it is a one size fits all. Okay,
Right.
unless you can't take the pressure, they'll work you up
Cut
to
it down.
it. But I think, at least in my conclusion, my humble opinion is that no hyperbaric oxygen, or I should say any hyperbaric oxygen, unless you're not going up too high, is better than no hyperbaric oxygen. And so so dose is it. What do you think about the dose? Like,
Well, while you were just sharing that, I kept thinking that, one of the gifts, in my opinion, of hyperbaric is that, for example, for someone with Lyme or COVID, that it does so much for your brain. Hyperbaric, getting that oxygen into your brain. We know this, right? We know this with veterans. We know that it can help with PTSD, depression, anxiety. So the mind-body connection is so strong. I think that's another thing that's not talked about, right? Is the mind-body connection and healing. And giving my brain that surge of oxygen, I'm convinced, helped my brain signal to my body, okay, let's heal. Let's take care of this. So I think it's kind of two part. Like you can address the bug or the infection or whatever it happens to be with a specific dose that may be measured in a clinical trial type atmosphere. But to me, it's also just the surge of oxygen to the brain that's so healing, that really communicates to the body and brings it all together. That's a critical part for me, and that's also not talked about a whole lot. In alternative medicine it is, but in mainstream medicine we just don't, we separate it. It's a big separation between kind of mind, body, and heart in healing, and
that's interesting. Yeah, I think it's very interesting. And Western medicine or mainstream medicine, as you just said. One of the things that I think, correct me if I'm wrong here, but I would say Western medicine focuses a lot on the symptoms.
Yes.
And not the cause. And you're sort of going to one of the roots of the cause is that the brain is not signaling healing.
Yes. Yes, and it's very powerful, and I think,
So I'm curious, with Lyme disease, did you have difficulty sleeping?
Gosh, it was awful for years and years. Yeah, and actually, my Lyme disease doc had a hyperbaric chamber that was small, and she said to me a number of times we could put you in there, but I was so claustrophobic that I was like anything but that. Now, with with the knowledge that I have now, I'm like, gosh, I wish I had figured it out and gotten in that chamber all those years ago. But then I'm a believer in you where you're supposed to be at any given time, and I came to Extavita when I was supposed to come for that. But what was your question about Lyme? Sorry.
Sleep.
Sleep. Oh my gosh, it was absolutely awful. Just for years, I would say just in the past, just in the past year, probably since I started doing the hyperbaric a little over a year ago, I started really having continuous deep sleep, and it had been 6-8 years, maybe longer, of really awful sleep that was affecting my life. Yeah, it was a really awful part of the disease that I experienced, was the sleep.
That's one of the most consistent things you hear from individuals that have gotten hyperbaric oxygen is if there was a sleep issue, it's almost immediate. Within a couple treatments, their comments are, they're sleeping through the night.
After the first one, I went home and slept 12 hours. And I got up the next morning and my husband was like, "You just slept 12 hours." And I was like, how do you argue with that? I went in one time and then it just, that was kind of, now that I think about it, that was kind of the beginning of my sleep healing.
Yeah.
Was when that big shift started happening.
And I know there's a lot of studies that talk about the importance of sleep for your body to heal.
Oh God, it's critical. It's absolutely critical. I think everyone can, Western and non-traditional medicine will agree on that, how critical sleep is. But then if you're not sleeping and you get stressed about your not sleeping and you become more anxious about not sleeping, it just becomes a vicious cycle. And honestly, that's where the brain healing helps the body, in my opinion, the brain healing helps the body ease into that healing state rather than a hyper anxious state that allows for more, the really deep therapeutic healing. Yeah.
Now, I hear it's your opinion, and I think you're aware too that there's a lot of research out there that points to what you're saying.
Yes.
It's not.
Yes.
You're not alone in there. Now, as we say, there's a case study here. You're a case study.
Yeah.
N of one, right?
N of one. Mm-hmm.